Now, moving on to another important group of asphyxial death. We discussed about 3 groups, right? I told you about 3 groups. Number 1, hanging. Number 2, strangulation. Number 3, it is suffocation. We discussed about hanging. We discussed about strangulation. Now we're going to discuss about suffocation. Right? What is suffocation? In this condition, what happens is there is no neck compression at all. There is no neck compression at all, right? You can see it's a pure form of asphyxia wherein there is exclusion of air from the lungs. There is exclusion of air from the lungs. We call this as suffocation deaths. Under this, we have a long list. We'll be discussing one by one. To start with, we'll start with the first one, that is smothering. What is smothering? You are closing the mouth and nostrils together. When you are closing the mouth and nostrils together, we call this as smothering. How are you closing the mouth and nostrils? Either you can use hands or you can use any pillow or any other means. Any means. Fine. So that is basically smothering. You can have a lot of manner is there. You can have accidental smothering where you can see it can be accidental, it can be homicidal, right? So if you see accidental, if the infant is there, infant is sleeping on the bed and the face of the infant is covered by a heavy bed sheet. Heavy bed sheet. Or if child is there, right? Children playing with the plastic cover, right? The plastic cover over the face, plastic bag over the face. That can also cause accidental smothering. Fine. And what happens in adult? Right? In adult, right? People falling into the sand, the face, right? Into the mud, right? Fall into the sand. Fall into a pile of sand, right? The face will be covered with the sand. The person cannot breathe because the nostrils and the mouth totally both are covered and the person will be accidentally smothered. This is accidental smothering. We have one more, that is homicidal smothering. What is this homicidal smothering? You kill a person by applying your hands or by pillow. You can either use pillow to close the mouth and nostrils or you can use your own hands to close the mouth and nostrils of the person. But when you are using your own hands to close the mouth and nostrils of the person, what happens is you are closing like this. You are closing like this. So when you have fingernails, it may cause nail abrasions around the mouth. Right? You are applying so much of pressure on the lip. When you are applying so much pressure on the lip will be pressed on the teeth. You can have a lot of injuries inside. Right? You can find perioral injuries. It can be bruises, it can be abrasions. It can be abrasions or it can also be bruises. Right? And you can even find the lip contusion. Sometimes there can be rupture of frenulum. Right? So all this is so significant that there was a pressure on the mouth and nostrils by means of hands. Right? So this is homicidal smothering. Homicidal smothering. Usually elderly people who are so weak, right? Children, infants, right, can be easily killed by this kind of smothering. Fine. And suicidal smothering. Is it possible? Right? Suicidal smothering, is it possible? No, it is not possible. Right? It's very, very unlikely. We can say it's very unlikely. Right? Accidental is common. Homicidal is common. So this is basically smothering. You can see this is smothering by using a pillow. Right? You can see this is using hands to close the mouth and nostrils. Right? You can see the perioral injuries around the mouth. I told you, right? Because of the pressure to apply on the mouth, you can see perioral injuries. When you look at the lip inner side, you can see the contusion may be there. There can be laceration or there can be frenular tear can also be there. So all this is basically smothering. Right? Now the next type of smothering is called as gagging. What is gagging? Gagging is something where you are thrusting a cloth or pad into the mouth of the victim. This cloth or pad goes and blocks the pharynx. It blocks the pharynx, nasopharynx and oropharynx. The person is not able to breathe. Person dies of asphyxia. So this type of asphyxia is called as gagging, where you are thrusting a gag into the mouth of the person. What is a gag? The cloth or the pad that we use is called as gagging. Right? So it is basically you are using gag right, and it causes asphyxia. This method is called as gagging. Usually what happens, suppose when somebody is kidnapping the victim is shouting, right, the victim hands are tied from behind. Fine. What they are doing is, because the victim is shouting, they will take a cloth and they'll stuff into the mouth of the victim. The cloth will gradually, it will go into the pharynx. It gets swollen because of the oral secretion. It gets swollen. It goes to block the air entry itself. When the air entry is completely blocked by this gag, you call it as gagging. The victim will not be able to remove it because the hands are tied from behind, right? So you know this kind of death is usually unintentional. Why unintentional? Here the accused does not want the victim to cry. The accused does not want the victim to shout. Okay, the intention is not to kill the person, but somehow the person dies, right? But still, this kind of death here, it is homicidal, right? It is homicidal. Fine. Right. Now the next type of asphyxia, that's called choking. Choking. What is choking? See here, choking. You can see choking in a normal person. In a normal person, right, who's having good cough reflex, gag reflex, this person while eating, there is sudden entry of FB into the mouth, right? What is that FB? FB is basically foreign body or food bolus, right? There is entry of food bolus or any foreign body into the airway, because of which the person is having respiratory difficulty. Because it is blocking the airway, the person is not able to breathe. The person is coughing. The person is coughing. You can see cyanosis in the face. The person is not able to talk, right? He is keeping his hand like this. The person is not able to talk. He is having difficulty in breathing. He is having intense coughing. All these respiratory difficulties there, and that might result in asphyxia and death of the person, right? The person may die of asphyxia. So this kind of death is choking. This type of death is choking. You can see that what is the first aid that we have to do. Here you can see this is the first aid. We have what is called as Heimlich maneuver. From behind, you give pressure onto the epigastrium towards upside, so the foreign body might be coming out. So this is the first aid that we have to do. This is called as Heimlich maneuver, right? This is Heimlich maneuver. So we are talking about choking. This is a normal choking. But what if suppose the person is intoxicated, right? If the person is under the influence of alcohol, or if he is under the influence of some other intoxicating substance, or the person is completely drugged, right? If the person is under the influence of intoxication or drugged, what happened here is, here you know very well, there is depressed gag reflex, right? When a person is under complete intoxication, the gag reflex is completely suppressed. In this case, what happens? You can see a obese person while eating under the influence of alcohol or any intoxication, you can see the person suddenly he dies. Sudden death, right? Sudden death is there. You just now saw this fellow, he was eating. You just now saw that fellow that he was eating, suddenly he is found dead. For you to look at this person, it might look like the person dies of myocardial infarction. It may be looking that the person died of myocardial infarction, because just now the person was looking normal, just now the person was eating, and he was suddenly found dead. It might look like the person dies of myocardial infarction, and that is the reason why this condition is called as café coronary. Do remember, it is called café coronary. But do remember, guys, this person, the cause of death is not due to myocardial infarction. It is basically a misnomer. The person does not die of myocardial infarction. The person dies of vagal inhibition of heart. Right? The vagus has stopped the heart. Vagal inhibition of heart. That is the cause of death in café coronary. That is the reason why we are telling that it's a misnomer. It's a misnomer. Café coronary term is misnomer. If you know this, the term café coronary was given by a person called Ronald Hogan. Right? Ronald Hogan. He was a person who coined this term café coronary. Okay, doesn't matter. Just know cafe coronary, right? And the cause of death is vagal inhibition of heart. Do remember, if the person is normal, if he's having normal cough reflex, he'll be having respiratory difficulty. If the person is completely intoxicated, there is no respiratory difficulty, directly you find the person dying, right? So that is called cafe coronary, right? Do remember that is cafe coronary. Now we'll be moving on to another type of asphyxia under suffocation itself, that is called traumatic asphyxia. So we have what is called as traumatic asphyxia. I just want you to know the mechanism properly. I'll tell you the concept, listen to me, right? Then I'll tell you, right, what are the conditions where you can see like that. What are the situations where you can see like that. See, here what happens, there is restriction. There is restriction of lung expansion, right? Whenever there is restriction of expansion of lungs, what happens? The person gets asphyxia. The person gets asphyxia. The person dies. But what is causing this restriction of lung expansion? Why the lung is not able to expand? Right? The lung is not able to expand because there is mechanical fixation of heart. Why the lung is not able to expand? Why the lung is not able to expand? That is because there is mechanical fixation of chest. Chest is mechanically fixed. Chest is mechanically fixed. What do you mean by mechanical fixation? There can be some external object is compressing the chest. When there is external object or external weight is compressing the chest, the person is not able to move the chest, lungs are not able to expand, person dies. Right? Now, what is causing this mechanical fixation? What is blocking the chest? What is compressing the chest? Any heavy weight on the chest. When there is any heavy weight on the chest, for example, see, this kind of situation is very commonly seen in case of stampedes, right? Stampedes, very common. Or if there is any person who was burying alive, right? They dig a pit, they put the person alive and they put all the sand to close the pit, right? Burying alive, the weight is compressing the chest, right? But in case of burying alive, it is not only that traumatic asphyxia, some component of the smothering will also be there, because even the airway is closed, right? The external airways are closed, right? So stampedes, burying alive, you can see building collapse. If there is any building collapse, the heavy weight of the building falling on the chest, the person will not be able to breathe. Okay, so that is another form of traumatic asphyxia. So in all these situations, what is common? There is mechanical fixation of the chest. When there is mechanical fixation of the chest, lungs are not able to expand, the person dies. Do remember, this type of death is called as traumatic asphyxia. Right? This is called traumatic asphyxia. Very, very important. Right? What is the keyword? Mechanical fixation of chest. Fine. Now you can see that the different situation wherein you can see the mechanical fixation of chest. That is heavy weight on the chest. You can see there is heavy weight on the chest, building collapsing, falling, bricks falling on the chest. Person is not able to breathe. Any other heavy weight. You sit on the chest of the victim. When you sit on the chest of the victim, heavy weight sitting on the chest, the person is not able to breathe. The chest is completely fixed. When so much weight is there on the chest, you cannot breathe totally. The person dies of asphyxia. This is also traumatic asphyxia. But the point here is, you can see that there is heavy weight sitting on the chest. Right? The chest is not able to expand. Because you have so much weight on the chest, there is no venous return from the upper part of the body into the chest. So what happens? You can see the part of the body above the level of obstruction will be completely cyanosed. Will be completely ecchymosed. Will be completely cyanosed because there is no venous return. There is no venous return. The point where you can see, the point where the heavy weight was there, you can see this area will be completely pale, and sometimes you can even find fracture of the ribs, right? The part of the body above the level of obstruction will be completely cyanosed, right? It will be completely cyanosed, and this type of finding is called as mask ecchymotic. This is called as mask ecchymotic. You can see this part of the body is completely, and the face is completely cyanosed, intensely ecchymosis. That is called mask ecchymotic. As if the person is wearing a mask of ecchymosis. That's why it is called as mask ecchymotic. You can see this is another picture of mask ecchymotic. right? This is a feature of traumatic asphyxia. Do remember, if they ask you where do you find mass ecchymotic, it is seen with traumatic asphyxia. Right? So this is one important mechanism, one important condition wherein you can see this restriction of lung expansion. But the same restriction of lung expansion can also be due to abnormal position of the body. If the body is in abnormal position, right, when the lungs are not able to expand due to abnormal position of the body, do remember guys, now you call this as positional asphyxia. Right? It is called as positional asphyxia. It's very simple. If the person is getting asphyxiated because of weight on the chest, you call it a traumatic asphyxia. If it is due to abnormal position, you call it as positional asphyxia. What are the examples of this positional asphyxia? Number one, you can have jackknife position. Right? Jackknife position. We also have one more position that is called inverted crucifixion. Right? See, inverted crucifixion is a form of torture. I'll show you. This is jackknife position. You can see one half of the body will be on this side, another half of the body will be on this side. You can see that all the abdominal organs is going to compress the diaphragm. Lungs cannot expand, person will die. That is called jackknife position. Right? Jackknife position. Earlier, this kind of position was preferred for conducting surgeries. Certain kind of surgeries they used to prefer, but one of the most important risk of this position is the person can die due to positional asphyxia. This is called inverted crucifixion. You can see the person is in an inverted position, upside down. Right? It is so obvious that you know very well the lungs cannot expand. That is because these organs will compress the lungs. The person cannot breathe, he'll die. Right? So this is another condition, another situation wherein the person can have positional asphyxia. Right? I told you two important conditions. Number one, jackknife position. Number two, inverted crucifixion. Right? Okay, moving further, this is called overlaying. What is that overlaying? This kind of situation normally happens when a larger person shares the bed, usually the small bed, with a small baby, usually infant, newborn. Right? So what happens during sleep, if the adult person, if the person rolls, the baby gets asphyxiated. Right? We call it as overlaying. Again, there can be a component of smothering. Along with traumatic asphyxia. The common example what they tell when obese lady shares a small bed with a newborn baby, during sleep that baby might be dying. Right? So this is called overlaying. Right? Overlaying. Fine, you can see another important method of killing. So this is basically a kind of homicide. What is that? This is called burking. What happens here is, you can see the accused sitting on the chest of the victim. He closes the mouth and nostrils. Right? When he is closing the mouth and nostrils, wherein the victim will get smothering. You know very well, smothering is a closure of mouth and nostrils. In addition to that, you can see the accused is sitting on the chest of the victim. Here is where there is mechanical fixation of the chest. There is a component of traumatic asphyxia. Right? So when there is a combination of traumatic asphyxia and smothering, we call this as burking. The term burking, it is derived from the person William Burke and William Hare. They are the two people. They used to kill beggars, strangers, prostitutes. They call them to the house. They give them more alcohol, food. Once the person is completely intoxicated, they'll kill by sitting on the chest and closing the mouth and nostrils. The victim completely dies without any struggle. They used to sell this dead body to an anatomy professor called Dr. Knox, Robert Knox. Right? The Robert Knox was anatomy professor. He used to have this body for dissection purpose, for demonstration to medical students in those days. Right? Many people, more than 16 victims have been killed by this method, and finally they got caught. William Hare became approver. William Burke, he got convicted and he was given death sentence. He was publicly executed in London Bridge, right, by hanging. Now still you can see his skeleton in Edinburgh University. The skeleton of William Burke is preserved in Edinburgh University. If you go to Edinburgh University, you can see William Burke's skeleton. Right? So this is basically burking. So this type of death is called as wedging. Sometimes what happens when there is a gap between, see, the baby sleeps on the bed, right, close to the wall, but there is a small gap between the wall and the bed. In this small gap, accidentally, if the baby falls into that gap, the baby gets wedged between the wall and the bed, the baby can get asphyxiated, right? The baby can die. So this type of death is called as wedging. This type of asphyxia is called as wedging. Predominantly, you will find traumatic asphyxia where the baby is compressed between the edge of the bed and the wall, right? So the gap between the wall and the bed is always dangerous, particularly when the baby is on the bed. So suffocation, we have something called environmental suffocation. Environmental suffocation, wherein, see, suffocation in the environment, basically there is lack of oxygen. There is lack of oxygen in the air, right? Particularly when a person got entrapped in a confined space. When the victim got entrapped in a confined space, there is no oxygen, the person can get suffocated. For example, if the person got stuck in a sewage tank, right? Or if the person got stuck in an unused well, he has fallen into unused well, or he got caught in a small box, right, where there is no oxygen, and the person will die from what is called as environmental suffocation. Guys, now we'll be moving on to another important module, that is called drowning. Very important topic for examination purpose, right? So this drowning, what is basically drowning? This is the WHO definition. It is a process of respiratory impairment. The person is not able to breathe. It is a process of respiratory impairment due to either submersion or immersion in water. You don't need the whole body underwater for a person to die. It's not like that. Complete submersion is not needed for a person to die, right? Complete submersion is not needed. Even if only the head is immersed underwater, the person can die. Okay? So completely submersion is not needed. Fine. Here we'll be discussing about the different types of drowning, the whole pathophysiology of each drowning, and we'll also be discussing about the postmortem findings in a case of drowning. How to do dissection, what are the findings that we'll have to look for in a case of dissection. So all these things we'll be discussing now. To start with, let me tell you the mechanism, and then I'll tell you the pathophysiology of each type of drowning. So let's start about that. Imagine a person has accidentally fallen into water. Accidentally, that is important, because most of the death in drowning, it is always accidental, right? Most of the deaths are accidental drowning only. Now let's talk about that. Let us assume a person has fallen into water, right? Person fallen into water, right? Into water. When he has fallen into water, immediately he has gone into panic. The person got frightened, panic. He is holding his breath, right? He is holding his breath. You can see the person is holding his breath, right? Breath holding is there. But breath holding, you can't have it for a long time. Finally, the person will develop hair hunger, and that will result in involuntary inspiration. You can find involuntary inspiration, right? When I tell you it is involuntary inspiration, it is not only the air that is going in, it is also the water, the medium that is going in, right? You can see the water entering into the airway, right? Water entry is there, right? Water entry is there. But if the water that is entering into the pharynx and the airway, right? If there is rapid entry of water into the pharynx, it causes immediate reflex vocal cord spasm. Do remember, it causes reflex vocal cord spasm. Because of the sudden entry of water into the airway, you can see the vocal cord closes completely. When it is closing completely, the person, it is not only the water that is going inside, right? It is not only the water is blocked from going inside, it is also the air that cannot go inside. So air is also getting blocked. The person will have asphyxia. It will result in death of the person, right? It will result in death of the person. Fine. So this is very important, because when the water is entering into the pharynx, what happens is the vocal cord reflexively shuts down, so that it is stopping the entry of water into the lungs. But what happens is even the air is also getting blocked. The person suffers from asphyxia. This type of drowning is called as dry drowning. Why it is called dry drowning? Because the lungs are dry. Right? Water has not gone into the lungs. Lungs will be dry. That is the reason why it's called dry drowning. Now imagine, see, the water has not gone down. Imagine, suppose water enters into the lung itself. If the water enters into the lung and the alveolus, you call this as wet drowning. Right? Why it is called wet drowning? Lungs will be wet. That's why it is called as wet drowning. As simple as that. Right? But here the mechanism will differ depending on the quantity of water that has gone inside. How much amount of water that has gone inside, that is important. So we'll be discussing about that. You can see that if the amount of water that has gone down into the lungs is 4 ml per kg body weight. If the amount of water that has gone down into the lungs, it is 4 ml per kg body weight, what happens is you can see that the water has gone into the alveolus, assuming that this is the alveolus. Right? You know very well, alveolus is normally surrounded by surfactant. It is lined by surfactant. So what happens when lot of fluid, lot of water entering into the alveolus, it is washing away all the surfactant. Right? All the surfactant is washed away. Right? When you know very well what is the role of surfactant, right? The surfactant is enough, it is important, it is essential for the alveolus to keep open, to be patent. What happens when the surfactant is washed away? The alveolar will collapse. Right? You know, when the surfactant is washed away, that results in alveolar collapse. When there is alveolar collapse, right, there will be impaired VP ratio. You know what is VP mismatch? Right? Whenever there is VP mismatch, right, ventilation perfusion mismatch, the person cannot get adequate oxygenation. It will result in cerebral anoxia. It will result in cerebral anoxia, and the person dies because of that cerebral anoxia. Right? So this is the actual mechanism that happens when the quantity of water entering is 4 ml per kg body weight. So this mechanism is very important. Right? This is the common mechanism. Commonly what happens, only 4 ml per kg, around average, if you see 4 ml per kg body weight that enters into the lung, it causes alveolar collapse, it causes VP ratio mismatch, and the person dies of asphyxia. But what if the quantity of water that has gone down is increasing more? If you say, if the quantity of water that has gone down is 16 ml per kg body weight, right? If it is 16 ml per kg body weight, now the mechanism differs depending on the nature of water. Depending on the nature of water. What is the nature of water? Either it is a fresh water or it is salt water. That is important. That is important. So we'll discuss about that. Imagine that the person has fallen into fresh water. Right? Fresh water. Fresh water is normally, it is hypotonic. Do remember, it is not hypertonic, it is hypotonic. You will have only 0.5% N. Right? Hypotonic. Only 0.5% N. Now what happens? Let us assume this is alveolus. Right? Let us say this is alveolus. Right? You can see this is alveolus, which is normally surrounded by pulmonary capillaries. Right? Blood is coming from the right side heart, it is entering into left side heart. Blood is coming from right side heart, it is entering into left side heart. Right? You can see that here what happens is, if the person has fallen into fresh water, imagine that if the person has fallen into fresh water, you can see the fresh water is filling the alveolus. Right? You can see the fresh water is filling the alveolus. What is the nature of this fresh water? This nature of fresh water is hypotonic. So what happens is, the fluid movement will be from the alveolus into the blood. The fluid movement will be from the alveolus into the blood. What happens is the blood is totally diluted. Blood, because you get lot of water entering into the blood is totally diluted. We call this as hemodilution. Right? We call this as hemodilution. Right? But because of this hemodilution, you have a lot of consequences. What are the consequences? Number one, if there is excessive hemodilution, it results in what is called as RBC swelling. The erythrocytes will become, due to osmotic pressure, the RBC will get swollen. You will see swollen RBC, it will rupture. When it is swollen, right, it will rupture, resulting in what is called as hemolysis. Right? Rupture of RBCs, lysis of RBCs. When the RBC is getting lysed, normally you have a lot of potassium intracellularly inside the RBC that will come out. What does it mean? It causes hyperkalemia. You get lot of potassium outside. Right? Hyperkalemia. On the other side, you can see you have hemodilution. This hemodilution is basically increasing the circulating volume of the blood. The blood volume increases. When the blood volume is increasing, it causes hyperolemia. Right? It causes hyperolemia. The person will have cardiac overload. Right? When the volume is so much, the heart cannot manage. It results in cardiac overload, resulting in what is called as ventricular fibrillation. Right? The person may die of ventricular fibrillation. Do remember, it is not only the cardiac overload is causing ventricular fibrillation, it is also the hyperkalemia that will also increases the risk of ventricular fibrillation. The person can die of ventricular fibrillation. So this is the whole mechanism that you get in a freshwater drowning. This is so important. I hope your concepts are clear. Do remember, so whenever there is hemodilution, you can see there is increased blood volume that causes ventricular fibrillation. Simultaneously, you will also get hemolysis, hyperkalemia, resulting in ventricular fibrillation. The person can die. So this mechanism of freshwater drowning is very important. I have just given you the whole flow chart of pathophysiology. You have to have a complete understanding about this concept, right? You can see when the person is in freshwater drowning, the most important finding is hemodilution. There is cardiac overload, person can die of VF. Not only that, there can be cellular RBC will get swollen, that will rupture, resulting in hyperkalemia, that will cause ventricular fibrillation. Remember, this happens in freshwater drowning. Imagine the person fallen into salt water. Assuming that the person has fallen into salt water, you can see this is salt water, sea water, right? You know very well the salt water is hypertonic. It is not hypotonic, it is hypertonic. 3.5 to 4% N will be there. Just do remember it is hypertonic, that should be fine. Salt water is hypertonic. Now imagine the person has fallen into salt water and this is your alveolus, as always, right? And you know very well, as always, there are pulmonary capillaries surrounding it. You can see pulmonary capillaries surrounding it. This is right side heart and this is left side heart. Now you imagine person has fallen into sea, salt water. The water has gone into the alveolus. You can see the salt water is filling the alveolus. Now the point is, do remember here, it is hypertonic water. Due to osmosis, what happens is it will attract all the water. Now the point is, the water, the fluid movement will be from the blood into the alveolus. It will be from the blood into the alveolus. You can see here in fresh water, it is from the alveolus into the blood. Here in salt water, it is exactly opposite. From the blood into the alveolus, you can see the lungs will be completely edematous. The person can die of pulmonary edema. Right? The person can develop pulmonary edema. He can die of respiratory failure. This is one important mechanism. In addition to that, you can see that the water you have taken all the water from the blood. So the blood which is coming out in the left side of the heart, do remember it is completely concentrated. We call this as hemoconcentration. Right? it is completely concentrated, we have what is called as hemoconcentration. Because of this hemoconcentration, the RBCs will be completely shrunk in size. You can see crenated RBCs. In freshwater drowning, I told you swollen RBC. Here it is completely crenated RBC. Totally, because you have taken all the fluid out. But because of this hemoconcentration, what is happening in heme? Because of this hemoconcentration, you can see everything is rising. For example, you can see the sodium levels will increase. Chloride levels will increase. Magnesium level will increase. Serum strontium level, that will also be increased. That is because of the salt water. Not only that, you can as well find the hemoglobin level will also be relatively increased. All this is because of concentration that you can remember. Everything is increasing except potassium. Right? Potassium, that is hyperkalemia, was noted only with your freshwater drowning, not with saltwater drowning. I told you there is hemoconcentration. Blood is totally reduced. So what happens is the person will have hypovolemia. The person will have hypovolemia. Because of this hemoconcentration, the person will have hypovolemia. The person can have circulatory shock that results in asystole. The person can die of asystole, death. Right? Fine. So that is what you need to remember. As I told you, hypovolemia causes circulatory shock and the person can develop asystole. Right? I have given you the mechanism in freshwater drowning. I have also given you the mechanism in saltwater drowning. You can see that from the beginning, I told you it is dry drowning, wherein there is reflex vocal cord spasm. There is reflex vocal cord spasm resulting in asphyxia. When the water goes down, you call it as wet drowning. Right? When it is only 4 ml per kg body weight, there can be VP mismatch because of washing away of surfactant. The person can die of cerebral anoxia. If it is freshwater drowning, I told you it is hypotonic water. It is hypotonic water. It will cause hemodilution. When it is causing hemodilution, it causes hyperkalemia, ventricular fibrillation. Hemoconcentration that happens with saltwater drowning, because it is hypertonic, I told you person can die of hypovolemia, asystole and death. In this, all the levels will increase. Sodium, chloride, magnesium, strontium, everything will increase. You can remember it is salt water. No, salt is sodium chloride. Imagine sodium chloride is getting elevated in salt water drowning, which is so easy to remember. Right? I have given you the entire pathophysiology in this flowchart. It is highly important for you to have clarity on this. Right? So you can see this is what is happening with wet drowning. Water goes inside, it is flooding the alveolus and it is causing washing away of surfactant. It will cause cerebral anoxia. If the quantity of water is more, it may cause freshwater drowning consequences or saltwater drowning consequences. This is dry drowning. You can see water stops here itself. In the larynx itself, there is reflex vocal cord spasm. The person dies of this asphyxia. Water has not gone down. That's why it is called as dry drowning. Okay, right. The next type of drowning is called as hydrocution, also called as immersion syndrome, which you got last year exam as well. Here, the person falls into cold water. What kind of cold water? They say it should be 5 degrees Celsius less than the body temperature. The cold water temperature must be 5 degrees Celsius less than the body temperature when a person falls into this kind of cold water. When a person falls into cold water like this, what happens is there can be water suddenly. See, the person is in anxious state. The person is emotional anxious state falling into cold water. Or if the water entering into the ear, or there is severe blow to the epigastrium, there can be epigastric impact from the water. Or if the person falls and duck diving. What is a duck diving? Feet falling directly into the water. That is duck diving. In all these situations, what happens? There is reflex vagal nerve stimulation. That is so important. Vagus nerve is getting stimulated. Vagus nerve is getting stimulated. Vagus nerve stimulation causes brady or tachy. It causes brady. Yes, very good. It causes bradycardia. Intense bradycardia causes cardiac arrest. Right? So that is why this is called as vagal inhibition of heart. Do remember, don't get confused between vagal stimulation and vagal inhibition. Vagus nerve is getting stimulated. Stimulated vagus nerve will stop the heart. That is called vagal inhibition of heart. We get it in hydrocution. right? It is called immersion syndrome, right? It is called as hydrocution. Very, very important that we see in cold water. We see that in cold water. Another type of drowning is there, that is called secondary drowning. Person has fallen into water, somebody has rescued the person out, but water has gone inside the lungs, right? That may cause complication. That is why it is called post-immersion syndrome. After immersion, person dies of this. Post-immersion syndrome, also called as near drowning. Here, the person can die of complication. There can be HIE. What is HIE? Hypoxic ischemic encephalopathy. The person can die of hypoxic ischemic encephalopathy, or there can be metabolic acidosis, there can be electrolyte imbalance, or there can be infection of the lung. That is most important, right? The person can die of aspiration pneumonia. Fine. So in all these complications, these are all the different complications that we can get. If the person dies of any of these complications, we can use the term secondary drowning, post-immersion syndrome, also called as near drowning. It's also called as near drowning. Right? So I have told you all the different types of drowning. I have also told you the mechanism behind it, the pathophysiology behind it. So you need to have a solid foundation on all these mechanisms. Right? Now we'll be discussing about the post-mortem findings in the case of drowning. We'll be discussing on the post-mortem findings. Right? So let us see if a person has fallen into water, or otherwise I'll tell you another example. See, when you see a dead body floating in the water, you are able to see a dead body floating in the water, right? Does it mean the person died of drowning only? No, right? It may be antemortem drowning. The person might have been alive at the time of fall into the water, or somebody might have killed the person, disposed a dead body into the water. So we don't know whether it is antemortem drowning or postmortem drowning, and that is what we are going to find out. Right, we're going to find out by doing post-mortem examination. So we have discussed all the different types of drowning and the pathophysiology. Now we'll be moving on with autopsy findings. Right, while you do autopsy, what are the findings that we have to look for the diagnosis of drowning? But most often what happens, the diagnosis of drowning itself, it's a diagnosis of exclusion. Right, you need to exclude everything out to diagnose it's a case of drowning. Right, sometimes what happens, the body will be in advanced decomposed state, right? The specific findings may not be that clear, right? In that case, like, we just have to exclude every other possibility, then we have to diagnose it's a case of drowning. It's a diagnosis of exclusion. In drowning, normally what happens, they can ask you flotation of the body. Flotation. When does the body floats? Flotation of the body. In summer, do remember, it is 1 day. In winter, it is 2 to 3 days. You can easily remember 1 to 3. 1 for summer, 2 to 3 days for winter. That is an easy way to remember. Now let's talk about drowning. See, if you see a dead body floating in the water, does it mean that the person died of drowning only? Does it mean the person was alive at the time of drowning? Right? It is not so. Right? It can be an antemortem drowning. It can be an antemortem drowning. It can also be post-mortem drowning. Right? The person might have been alive at the time of drowning, fall into the water, or somebody might have killed the person, disposed the dead body into the water. That is also possible. Right? So during our dissection, we just have to find out what is specific finding and what is non-specific finding. So we'll be discussing on that. Let's start with the findings first. Right? The first important finding that we can look for is cadaveric spasm. Cadaveric spasm. Right? What is that cadaveric spasm? Right? Presence of grass or mud. Presence of grass or mud tightly clenched in the hands of the victim. It is not just the presence of grass in the hands of the victim. No, presence of grass tightly clenched in the hand. See, when a person has fallen into water, he is struggling to come out of the water, he'll catch hold of something, and that group of muscle will be in spasm even after death. If this is the grass will be held tightly in the hands of the victim. That means you can see this is cadaveric spasm. When you can see this kind of grass tightly clenched in the hands of the victim, we can say that the person was alive at the time of drowning. We can say this is a sign that is suggestive of ante-mortem drowning. Right? Only when the person is alive, he will struggle and he will catch hold of something. Right? So this is a sign suggestive of ante-mortem drowning. Now moving on to another important finding, that is basically nothing but froth in the nostrils. Right? We can see froth in the nostrils, sometimes in the mouth as well. We can see froth. Right? But this froth is highly important because the froth that we see in a drowning victim is fine. It is tenacious, means it is mucoid froth, and it is copious froth. You get lot of froth coming out, and it is persistent froth. Every word that I've written on the screen, it is important, right? It carries some meaning. See, it is a fine froth, it is not a coarse froth. Normally in decomposition you get froth, but that may be coarse, right? It is mucoid. It is copious and persistent. Even if you wipe it from the mouth, you apply pressure on the chest, it keeps coming from inside. That is why it is persistent froth. Because the froth is from inside the lung, not just from the mouth and the nostrils, right? That is why it is persistent. Now, let us look at the mechanism of this froth. What is the mechanism of this? So, let us look at the mechanism of froth. You can see that, assume that this is the airway, right? So, let us assume this is the airway, right? You can see this is the airway. Normally, you know very well, the airway is lined with mucus secretion. You can see this is the mucus secretions along the airway, right? When a person has fallen into the water enters into the airway. When the water has gone into the airway, it is irritating the airway. If the water goes inside, come outside, goes inside, come outside, it irritates the airway. The airway produces more mucus. You can see the presence of mucus. Lot of mucus is produced. And in the airway, lumen, we also have some air, right? And you see, this is your alveolus. Alveolus is lined with surfactant. You can see surfactant lining the alveolus. So this surfactant is also needed to produce froth. Do remember, we have got water, we have got mucus, we have got air, and we have also got surfactant. When all these things mix together, you get froth, right? When all these things mix together, we get froth. But this alone is not sufficient. There is one more component that is missing. What is that component? See, just because you have all the four things does not produces froth. What is needed? You need everything to be mixed. This kind of mixing effect is called as churning, right? When do you get this mixing? When do you get the churning? When the person has fallen into water, he is alive. I repeat, he is alive and he is struggling in the water to breathe. Right? When there is violent respiratory effort or when there is a respiratory struggle, that is mixing everything to produce froth. Right? That is mixing everything to produce froth. That means when the person is not breathing, right, you may not get froth. Not only that, you see, I've told you four important things. Water is needed, mucus is needed, air is needed, surfactant is needed, respiratory struggle, everything is needed. What if there is no water entering into the airway? It is a drowning, right? It is drowning case, but what if the water has not gone into the lung? In what type of drowning the water has not gone into the lung? Dry drowning, hydrocution, right? Where the entry of water is not the primary mechanism. In that case, we will not be seeing the amount of froth. We will not be seeing the presence of froth. There is no froth when the water has not gone into the lung. For example, it is dry drowning, right? Hydrocution. We will not be able to look at the presence of froth. And not only that, what if the person, see, for a froth to appear, you need the person to be struggling. What if the person is not struggling? Which person will not struggle even though he is alive? An unconscious person. When unconscious person drowned in the water, we will not be able to see the presence of froth. Right? When unconscious person drowned in the water, he is not breathing, he's not struggling, it's only passive filling of the lung with water, so you will not be able to see the presence of froth. So, right, these are the situations where there is no froth in the drowning case. Right? But I told you the mechanism of production of froth. I've also told you where you don't see froth. Right? You can see this is the appearance of the froth. It is so fine. Sometimes that can be blood tinged, can be there. You take it's mucoid, tenacious, right? So you take a tip of knife, you touch the bubble with that tip of the knife, it will not collapse. Fine. So this is your persistent froth. You wipe it again, it keeps coming when you apply pressure on the chest, because it is not from outside, it is from inside. It is from inside. So let us look at another finding. See, I've told you cadaveric spasm, I've told you froth in the nostrils. Both these signs are the signs of ante-mortem drowning. Right? Both these are suggestive of ante-mortem drowning. Now, what are the other findings? Right? One is cutis anserina. Cutis anserina, also called as goose flesh. You can see the hair follicle standing on its end like this. So this is your cutis anserina. If you look at the cutis anserina, does it mean the person was alive or not? Is it a specific sign or not? No, it is not a specific sign. It is a non-specific sign. Why? Why is that so? You kill a person, throw the dead body into the water. You throw the dead body into the water because of rigor mortis. You know very well, this is the skin. You have hair follicle standing on its, right? And you know very well there is erector pylori muscle attached to the hair follicle. When there is rigor mortis, you know very well rigor mortis occurs in each and every muscle of your body, including erector pylori muscle. When the erector pylori muscle is becoming stiff and shortening, what happens? The hair follicle will stand on its ends. Right? It will stand on its end. And that is why I told you that cutis anserina is non-specific sign. It is not a specific sign. This is a non-specific sign. The next important finding that you can see in the palms and soles, that is nothing but washerwoman's hands. Washerwoman's hands. Right? What is this? This is basically the maceration of the skin. This is basically maceration of the skin of the palm. Why is it due to? That is because entry of water into the skin layers. We call it as imbibition. It is basically imbibition of water into the skin layers. Doesn't matter whether the person was alive or dead at the time of drowning. It is only the entry of water into the skin layers. Doesn't matter whether the person was alive or dead. That is why this sign is again non-specific sign. Right? This sign is again non-specific sign. You can have a look at this washerwoman's hands. Right? Now you can see in the sole. This is washerwoman's feet. Right? You can see if it is washerwoman's hand or if it is washerwoman's feet, what are the findings that you can see? There can be wrinkling of the skin. There can be wrinkling on the skin seen around 3 to 4 hours of immersion. And then you will have peeling of cuticle. That happens around 12 hours. You can see bleached, completely white. Right? This is again 12 hours, and you can find soddening of the skin as well. That is seen around 24 hours. Right? That is seen around 24 hours. You can see wrinkling, peeling, soddening and bleaching. Everything is there. I told you just now, you can see that this is basically due to the imbibition of water into the skin layer. It is not a specific sign. Then why is it useful for? It is useful for finding out TSI. What is a TSI? TSI is basically time since immersion. Right? It is not time since death. Normally we say TSD, time since death, but it is time since immersion. You can find out how many hours the body was in the water based on these findings. Right? You see, it starts in the fingers. Normally this kind of changes, it starts in the fingers. Right? Then it involves the palm. Then it involves the back of hand, and then finally it involves the sole as well. Right? This is the progression. And this kind of findings, if the person got drowned in a warm water, it is more pronounced. More in warm water. Right? So all these are washerwoman's hand. Do remember, it is not a specific sign. That's what you need to remember. And so far we were discussing all the external findings. I've told you 4 findings. Number 1, it is cadaveric spasm. Number 2, it is froth in the nostrils. Number 3, it is your cutis anserina. Number 4, washerwoman's hand, out of which 2 are specific and 2 are non-specific. Now let's move on to internal findings. This is again very, very important. The most important organ that we'll have to examine is lungs. right? The primary organ that we have to examine is lung. Let's look at the lungs, right? Let's talk about lungs. Let's talk about lungs. When you look at the lungs, you can see that, let us assume this is the lung of the person, right? You can see this is so bigger, right? It is so voluminous. Fine. You can see this is your trachea. Fine. So it's a lung and the trachea. When you look at the lung, just you open the sternal plate, right? During dissection of drowning victim, you open the sternal plate, lungs will pop out because it is so voluminous. It is so voluminous, right? You touch and feel it. It is crepitant. And when you open the sternal plate, you can see ballooning of lung. You can see lungs ballooning out. Ballooning of lungs noted, right? Which was asked in your last year exam as well, right? So you can see voluminous lung, you can see crepitant lung, ballooning of lungs, everything is seen. Now, when a person has fallen into water, it is not the water alone that is going inside. If the person was alive, some amount of mud particle. You can see presence of mud in the airway, right? Water and the mud in the airway, particularly when it is in the lower airway, it is so specific, right? When it is in the terminal bronchioles, the lower airway level, the presence of mud is so specific, right? Now let us look at the other finding. I told you the lungs are so voluminous. If suppose the person was conscious, and he has fallen into water, let us assume the person was conscious. A conscious person fallen into water. You know very well, when a conscious person fallen into water, he struggles to breathe. There will be respiratory struggle. When there is respiratory struggle, what happens? There can be rupture of alveolar capillaries. You can find there can be rupture of alveolar wall. There can be rupture of alveolar capillaries. Because of these ruptures, you can find some hemorrhages in the surface of the lungs, particularly in the lower lobe. You can see these kind of hemorrhages in the surface of the lung. Do remember, these hemorrhages are called as Paltoff's hemorrhages, right? Do remember, these hemorrhages are called as Paltoff's hemorrhages. Do remember, we have seen petechial hemorrhages in asphyxial death, right? In the introduction, I told you petechial hemorrhages, which is also called as Staude's spars. Petechial hemorrhage is something different. Paltoff hemorrhage is something different. Petechial hemorrhage is non-specific hemorrhages that you can see in all asphyxial death. Paltoff hemorrhage is specifically due to drowning, where there is rupture of alveolar capillaries and walls, right? As I told you, this is normally seen as a patch. You can see that predominantly in the lower lobes. Predominantly, it is seen in the lower lobes, right? These are called as Paltoff's hemorrhages. Why is it due to? When the person is conscious, when he's struggling to breathe, you can see the vessels, the wall and capillaries get ruptured, right? So that is seen with the person when he's alive and he got drowned in the water, right? That is a point that you have to remember. And you can see in the lower lobes, you can also see that usually it is in the subpleural areas. When a person has fallen into water, you see the lung, right? You can also see some kind of emphysematous bullae. You can see emphysematous bullae will be there. These kind of emphysematous bullae is called as these. You can see the presence of bullae, right? Emphysematous bullae, right? When you see these kind of findings, Paltoff hemorrhages, emphysematous changes, right? Emphysematous bullae, I told you, right? This is emphysematous bullae. When you see these kind of emphysematous changes, in addition to the Paltoff hemorrhages, do remember these findings are called as emphysema aqueosum, right? Emphysema aqueosum, right? Very, very important. This is called emphysema aqueosum, right? Why is it called emphysema aqueousum? You can see the emphysematous changes in the lung due to the entry of water into the lung, that is aqua. That is why it is called emphysema aqueousum. It's called emphysema aqueousum. It occurs when the person was conscious and he was struggling in the water. That means when a conscious person drowned in water, we will be able to find emphysema aqueousum. That is most important. Right? Do remember, I told you part of hemorrhages, I told you emphysematous bullae. These changes are called as emphysema aqueousum. It occurs when a conscious person drowned in the water. What if unconscious person drowned in the water? Assuming that unconscious person drowned in the water. When unconscious person drowned in the water, what happens? Look at the lungs. Lungs will be heavy. Yeah, you can see heavy lung. But you will find lot of edema. You will find lot of edema. The froth will be very little because he's unconscious. It's only passive filling of blood in the lungs. So lot of edema will be there. It is heavy lung. These kind of findings are called as edema aqueousum. When do you get edema aqueousum? Edema aqueousum is seen when unconscious person drowned in the water. Remember the difference. Emphysema aqueousum, conscious person. Edema aqueousum, unconscious person drowned in the water. This is what you need to remember. There is one more type of lung that is called hydrostatic lung. That is basically post-mortem immersion. You kill a person, throw the dead body into the water. So that is post-mortem immersion. That is hydrostatic lung. Right? So I have given you three important findings: emphysema, edema, hydrostatic lung. Do remember all the terminologies. This is again very, very, very important. Right? I have told you Poultoff's hemorrhages. Have a look at the Poultoff's hemorrhages. Particularly it is in the subpleural region, in the lower lobes. In the lower lobes you can see that Poultoff's hemorrhages. Apart from this, we have some more findings as well. We can see, right, I told you emphysema aqueousum, conscious person drowned in water. I told you edema aqueousum, unconscious person drowned in water. I told you hydrostatic lung, post-mortem immersion. Remember, just get acquainted with the three terminologies in case of drowning. I told you other findings are there. What are other findings? There can be water going into the middle ear. There can be water going into the stomach. There can be, you can see this is the stomach. Right, you can see the presence of water in the stomach. Right, you can also look at the presence of water in the small intestine. If you are able to see the presence of water in the stomach and small intestine, that is also, they say, it is one of the important sign of ante-mortem drowning. Okay, water in the stomach and intestine, water in the sinuses, which is called as Sveshnikov sign. Sveshnikov sign. Right, water in the middle ear, that is called Uno sign. Water in the middle ear, that is called Uno sign. Uno sign. Right? We will also be able to see the bleeding in the middle ear. That is temporal bone hemorrhages can be there, but that is not specific. We can see the temporal bone hemorrhages in many conditions. Even a decomposition itself will be able to find out. Head injury will be able to find out. So that is not so specific, but it may be noted in drowning case as well. Right? Now, looking at the important tests that we can do here. I have told you about the different findings that you can see internally. Now we'll be discussing about what are the tests to detect it is ante-mortem drowning only. Test in drowning. Let us have a look at the drowning test. The first and foremost important test is called as diatoms test. Diatoms test. What is basically a diatom? Only then you will know how to use this in the test. See, diatom is an algae. It is an unicellular algae. It is an unicellular algae present in all water body sources. It is present in the ocean, sea, river, lake, pond, well, everywhere you can see this. Right? But it will vary in size, in shape, right? The species, everything will vary from place to place. But what is so common, when you look at the diatom microscopically, this is, you can't see with macroscope, this is microscopically. When you see with microscope, the outer wall will be coated with silica. Outer wall is coated with silica. with silica. Underline the word silica, that is again important. In one of your examination, they asked outer wall coated with magnesium. That's a wrong statement. Remember, it is silica. Because it has got outer wall coated with silica, it is so hard, it is resistant to heat. It is resistant to heat. It is resistant to acid. It is resistant even for putrefaction. Even in decomposed bodies, we'll be able to look at the presence of diatoms. Right? Now, see, this is very important. It is resistant to putrefaction, so decomposed bodies also it will be useful. It is also resistant to acid. I'll tell you how to apply this principle. Now, assuming that the person was alive. The person was alive. Let us say this is the medium. Right? And you can see this is the liquid medium which is present inside the container. The person has fallen into the medium, water. Right? Person was alive. Person was alive and the person got fallen into this medium. There is diatom in this particular water source. When the person is alive, you can see that the water enters into the alveolus. Right? You can see water enter into the alveolus. In addition to the water, what is also entering into the alveolus? The diatom also enters into the alveolus. Fine. If the person is alive, you can see these diatoms. These diatoms will cross the membrane. Particularly, they say if it is between 40 to 60 microns, it will be able to penetrate the membrane. It enters into the blood. You can see the presence of diatom entering into the blood. And this blood, it is taken to the heart. You can see it is taken to the heart. Fine. If the person was alive, I repeat, if the person was alive, the heart is beating or not? Yes, the heart is beating. Right? The diatom is taken to the heart. The heart is beating because the person is alive. When the heart is beating, if the person is alive, the blood flow, right? Through the blood flow, the diatom is taken to the bone marrow. Right? Diatom is taken to the brain. Diatom is taken to the spleen, liver. It is taken to all visceral organs. Because the circulation is intact, along with the circulation, diatom is also taken in all these particular organs. Right? What does it mean? If the person was alive, you will be able to find the presence of diatom in these organs. So if you are able to see the presence of diatom in the distant organ like this bone marrow, particularly femur and sternum, right, or in the other organs like spleen and all, that means it is suggestive of ante-mortem drowning. We can say that the person was alive. Right? We can say the person was alive. It is a sign of ante-mortem drowning. It's very, very simple. Right? You need to take bone marrow. Right? You need to put acid. Commonly they use nitric acid that will destroy the entire bone marrow, but not the diatom, because I told you diatom is resistant to acid. Right? You need to process it, you need to centrifuge, you need to take that supernatant fluid outside, and you need to keep the remaining residue in the microscope. When you see through the microscope, you can see the presence of diatom. When you have diatom, that means circulation was intact, the person was alive. And you should also take the sample, control sample from the place where he has fallen, where he got drowned. Right? And there in the control sample, look for the diatom. If the diatom which is present in the control sample and the diatom which is present in the body bone marrow, both are same, then you can say this person got drowned in that water source. Right? That is why control sample examination is also important. Right? That is why it is important. Fine. Right. They say that it is suggestive of ante-mortem drowning. Right? But sometimes what happens, it is not useful if the water is not entering into the lung. This is useful only in case of wet drowning. That is most important. As you know very well, in dry drowning and hydrofusion, this is not useful. This test is not going to be useful. Right? It may have limited practical applications because there may be a lot of other factors which influence on it. Suppose if the person was drinking water from a water source and he got drowned to the same water source. Right? He has been drinking water from the water source for so many years and he got drowned to the same water source. Or when he is drinking water from the same water source for so many years, obviously you will see the diatom in his body. And he got drowned in the same water source, then there is no The practical application is of this diatom test is very, very limited, right? But still, for examination purpose, we need to remember it is called diatoms test. Okay, suggestive of antemortem drowning. That is what you need to remember. Now, moving further, let's talk about the next important test for your examination, that is called Gettler's test. I told you it is for examination purpose, right? Again, the practical utility is very less. They say that Gettler's test is basically comparing. What are you comparing? You are comparing the chloride concentration. You need to compare the chloride concentration. You need to compare the chloride concentration of the blood taken from the cardiac chambers, right? The heart chambers. You need to take blood sample from the right side of heart, maybe right atrium, right ventricle. You need to take blood sample from the left side of heart, left atrium or left ventricle. Compare the chloride in both the samples, right? So that is what is Gettler's test. If the difference, see, normally it should be same, right? Normal situations, the blood taken from the right side, blood taken from the left side, chloride ions should be equal. This is normal situation, is it not? If there is a difference of more than 25%, if there is a difference of more than 25% between two samples, right, then it is significant. Right, you can't say like it is only 5%, 4%, 1% difference. It's not like that. When it is more than 25%, they say it is significant. How can you find it? If it is freshwater drowning, let us say it is freshwater drowning, right? Freshwater drowning, you know very well. On the left side blood, you find hemodilution, right? When it is diluted, the chloride levels will obviously come down. Right? On the right side, it is same. It doesn't change. So when you compare both, which should be more, which should be less, right side will be more than the left side. Then it is called as freshwater drowning. Now, apply the same concept in saltwater drowning. In saltwater drowning, you know very well there is hemoconcentration. You know very well in saltwater drowning on the left side of the heart, the chloride levels will increase. We have already discussed about that. You can see chloride levels will increase on the left side. Right side it is same, it doesn't change at all. So which is more, which is less? Left side will be more than the right side, which is suggestive of saltwater drowning. If the right side is more, freshwater drowning. Left side is more, it is saltwater drowning. You can remember very easily. Right? Fine. So the difference of 25% is significant. Again, this test is not useful. This test is not useful if it is dry drowning. I told you these tests will be useful only in case of wet drowning. This is not useful for dry drowning. This is not useful for dry drowning. Not only that, it is also not useful if there is patent foramen ovale, because there is communication between right side of the heart and the left side of the heart. Blood will mix together. This test will not be useful. Right? So do remember, this is Gettler's test. I've told you about diatom test. I've also told you about Gettler's test. Right? I told you about the different types of drowning. Right? I told you dry drowning. I told you hydrocution, right? Freshwater drowning, saltwater drowning. Certain drowning are called as typical drowning. That means water will go into the lungs. Typical drowning, right? That is freshwater, saltwater. Certain drownings are called atypical drowning, where the death is not basically due to the entry of water into the lung, right? For example, dry drowning and your hydrocution. Dry drowning, hydrocution can be called as atypical drowning, and the remaining drowning, your freshwater drowning, that is saltwater drowning, can be called as typical drowning. Typical drowning.